Hello, my name is Kaylee Happenstead, and today I'm going to be talking about Mary Breckinridge and her impact on nursing. First, I will begin talking about the early years of her life and what that looked like. So, for her birthplace and family upbringing, she was born February 17th, 1881, in Memphis, Tennessee, nearly 144 years ago. She was second of four children. Mary was born into a wealthy and politically powerful family, where her father, Clifton Rhodes Breckinridge, was an Arkansas congressman and served as U.S. Minister to Russia. Her grandfather, John C. Breckinridge, was vice president under James Buchanan. Mary spent her childhood traveling between the U.S., Russia, and Switzerland due to her father's work politically. In the U.S., she lived in many states, including Mississippi, Kentucky, New York, and Washington, D.C. Breckinridge's early education was provided by private tutors and private schools. From 1996 to 1998, she attended the Rosemont Delaney School in Switzerland. Breckinridge returned to the United States in 1898 and entered the Low Haywood School in Stamford, Connecticut, where she finished her primary education in 1899. Mary moved to Arkansas in 1999 after graduating from primary education. In 1904, while Mary was 23, she married her first husband, Henry Morrison. 2 years later, though, while Mary was now 25, her husband died of appendicitis. That's when she decided to move to New York to attend St. Luke's Hospital Training School, where she graduated in 1910 as a registered nurse. While attending school at St. Luke's Hospital, Mary met her second husband, Richard Ryan Thompson. They married shortly after in 1912 and had a daughter and a son. Mary's daughter died just a couple hours after birth, and her son died at the age of 2. She decided to divorce her husband in 1920. After her tragedy she went through, it inspired her to serve as a nurse for mothers and children. In 1918, Mary went overseas to France to join the American Committee for Devastated France. While in this committee, Mary organized a visiting nursing program to help the French refugees of World War I. This program trained women as nurse midwives to provide care for areas in France that had limited nurses and doctors. Mary returned to America in 1921 to study public health at Columbia University. After realizing there was no college programs for women to study midwifery in the U.S., she decided to go back to London to obtain her midwifery certificate. She also went to Scotland to learn more about delivering healthcare to isolated areas. In 1925, Mary returned to America and started her work in rural Kentucky. She landed in Leslie County, Kentucky, and learned more about the people and their healthcare experiences. She learned that Leslie County was extremely impoverished and they had no medical services or support besides young people who were not trained medically. That's when Mary established the Kentucky Committee for Mothers and Babies, which later became known as the Frontier Nursing Services. The headquarters for the Frontier Nursing Services was located in Wendover, Kentucky, which took place in Mary's house. This was the first American healthcare group to hire nurse midwives. Due to this county being so poor, it was difficult to get healthcare resources. So what Mary did to overcome this challenge was she used all of her provided resources, including her student niece, who was good with film production, and she created a documentary about the nursing service. Her documentary was extremely successful and allowed for fundraising to build the first hospital in Leslie County called Hyden Hospital. Due to this county being so large, it made it difficult for Mary and her nurses to provide care to people that were far distances away. To overcome this challenge, they would get to patients' houses by horseback and pack everything they might need to help the patient in their saddlebags, since they would not be able to go back to the clinic for supplies. Mary's work and efforts were extremely successful. She lowered both the maternal and infant mortality rates below the national average. She also succeeded in providing resources and trained nurses to the area, improving the health outcomes of people within that county. Many of Mary's nursing staff at the Frontier Nursing Service came from Britain, and they wanted to go back home once World War II started, which left her understaffed. Not only was Mary now understaffed, But since there was no midwife nursing university programs in the U.S. and not being able to send people to Britain to become educated on midwife nursing due to the war, Mary had to come up with a solution. So, Mary created her own midwife university, which was named the Frontier Graduate School of Midwifery. According to Frontier Nursing University website, they enrolled their first group of women November 1st, 1939. According to the Frontier Nursing University website, their main focus is educating the next generation of nurses and nurse midwives and increasing the care of availability. These motives align with Mary Breckinridge's, as her last mission was to increase midwife-free care availability. Additionally, Frontier Nursing University focuses on providing education online so that it is more accessible to students who cannot go away to school. Mary spent the last years of her life traveling and fundraising for the Frontier Nursing Service. She published an autobiography called Wide Neighborhoods, a story of the Frontier Nursing Service in 1952. She passed away in Hayden, Kentucky on May 16, 1965.